Greetings from Citizen Health and the Team Academy IFAS and Connect. And today, in the series of People's Health It Matters, we have Dr. Tanvir, who is a professor and head of community medicine, Adesh Institute of Medical Sciences and Research, Bhatinda, Punjab. A very warm welcome to you, ma'am, on behalf of all the audience.
Thank you, Ritu. Thanks a lot for inviting me on this platform and sharing my views with the audience.
Thank you, ma'am. And today we are going to talk on a topic which we have discussed earlier also, but today we will discuss from the angle of Dr. Tanvir about the mental health problems. So, I would like to start my session with my first question, ma'am, that what is mental health and what exactly meaning of being mentally healthy?
Okay. So, Ritu, to start with, I'll just let everyone know that today we'll not discuss about mental illness, right? So, we will be more discussing about what is being mentally healthy. So, what do we call as a person who is mentally healthy? How he behaves and how how a normal person will be labeled as that this person is mentally healthy, because many of the times in newspapers and news and in media we are always listening to the part where the person is finally landing up when he's not mentally healthy, right? So as we all know that WHO also has stated that being healthy, mental health is one of the important component, right? So physical health is one thing, while being mentally healthy and socially healthy are the two other perspectives of a person to be labeled as healthy, right? So mental health in the definition itself also has taken a prominent place, that for a person to be completely healthy he should also have possess good mental health, right? So how do we define that a person is actually mentally healthy? Say for example, if I want to say that I want to assess myself whether I'm mentally healthy or not, I would like to focus on few points, right? It would be basically we categorize them into three or four things which a person should be able to do. The first and foremost important is that person is able to display his own properties, right? So which means self realization, what a person is capable of doing at a certain age with a certain level of education. So is he able to perform all those activities, all those things at that level? Secondly, we say that the person is a master over his environment, over the determinants around him, right? So something is not actually bothering him or making him upset or disturbing his routine life. So he has a mastery over the environment and over the factors which he can control, right? And third major thing which we say is that the person is autonomous means that he should be able to manage himself by his own virtues, like say for example decision making. So he should be able to take his own decisions, he should not be dependent upon, or he should be take a problem solver, he should not be dependent upon others for solving his problem. So these are the major things, and when all these things are there, we say that the person is mentally healthy, he is emotionally stable, right? He is confident and he is at peace with himself and in the environment, in the society where he's performing or working or living. So this is the basic concept of being mentally healthy.
Great. So, what do you think? What your experience say that how we Indians see this mental health or the mental illness?
Right. So this is a very important concept. Actually, when we talk about mental health, we always talk about not having depression, not having anxiety, not going for suicidal behaviors, right? So in our scenario, though it is there in the Western world also, but for Indians, we focus only that a person is mentally healthy if he is not displaying any of these features. And if he is displaying, then though we say that this person is not possible of leading a normal life, right? So I just want to clarify this to our community, to our people, that it is not necessary that a person will be on medication or going for treatment to a psychiatrist, then only we label him as mentally ill health, right? So ill health can be there even in the prior stages, where we sometimes, or I would say most of the times, we people are not able to recognize and not able to take proper help which is required at that time, and which can save us from landing into the later I would say the issues which are later on, like suicide and depression and anxiety, right? So as Indians, as in a community, as well as being parents, as we have our loved ones around us, we should be able to actually diagnose, or we should be able to open our eyes and ears and our minds to give help and to seek help whenever a person needs and he's at the verge of having some mental health problem.
In Indian society, actually, whenever we talk about mental illness, we talk about अरे ये तो पागल है या ये पागल हो चुका है. So what do you suggest, that what kind of disease and disorders came in this mental illness category?
Right, so that is what I was saying, that we should not label only the depression, the anxiety, the mood disorders, like we say the bipolar disorders, or alcohol abuse, or any other substance abuse. These are of course the last stages of a person being mentally ill health, but the process, like normally also for other diseases also, like we say hypertension हुआ किसी को, तो शुरू में क्या होता है, we don't go for the diagnosis, blood pressure बढ़ रहा है, बहुत सालों से बढ़ रहा है, but finally the person lands to a doctor only when he's having some heart failure or he's suffering from a stroke or something. So similarly for mental illnesses, so there is a long latent period which actually finally leads to this disease. So our focus actually for the community should be not to only treat those people who are being diagnosed at that stage, when we are actually labeling them as depression, as suicidal behavior, or as anxiety, but to manage the larger community as a whole, to stop them into, going into these risk behaviors and these problems.
So, what is the concept of mental health promotion?
Right. So that is basically what we talk about mental health promotion. We normally say prevention, diagnosis, treatment. So diagnosis, treatment, of course, we all understand. Ki person is suffering from signs, symptoms. He's coming to the doctor. We diagnose him. We treat him. Prevention is when a person is having those risk factors. Say, for example, I would say a person is having he has some history in the family, or he has abuse, some child abuse has happened, and the risk factor is already present, and the person is under stress, then issues, and then we go for counseling him or providing him help. But here, when we talk about mental health promotion, promotion would be acting even before these factors are actually appearing, those factors which are under our control, right? So basically in promotion, we will be focusing on the concept that how I can, or a person can change his behavior or change his characteristics, which would prevent him to going into landing into these mental illnesses. So we are going to focus on those behaviors, those lifestyles, those things which we want everybody to practice as a human being, so that he never lands into those scenarios where he might get that disease. So this is the whole concept of promotion, that we do it for everybody. It's basically, promotion is for everyone. Prevention, diagnosis, treatment is for one who is already suffering from a disease or is at risk of getting that disease.
Right. So, what do you think, that what is the role of society, community, and the other things that what we need to do for this mental health promotion?
So this is the role of community physician or a public health person, where we need to give mental health literacy, right? So mental health literacy is the only way by which we can have mental health promotion. You see, at a larger level, if we say the government is making schemes and programs, ki, okay, at every district there will be a psychiatrist and we can go. So that is, the government is doing at its own level. But for public health, for the promotion part, we have to act at the individual level and at the societal level or the community level. So if we talk about at the community level, right? So at the community level, we have, as an individual, a person is participating at various community organizations. Say, for example, if it is a child is going to school, right? So whatever environment, whatever factors we can provide in a school for promoting mental health, so it's basically the responsibility of that school, the organizations, to provide that good environment which will not allow the persons to land into problems, right? Similarly, now this is one example where a child, we say, is going to school, but usse bhi pehle, a person when is being born in a family, that is the first social organization, we say, the person lands into. So the family is one important component from where we get this support, we get that factors which will protect me in my life. That cushion, we say, is the family, from where we get those things which will protect us in later life for landing into mental illnesses, right? Then when, as we grow up, we go for workplaces, so many a times we see there are examples, and even we people suffer from, yaar stress bahut ho gaya, job pe ye ho gaya, wo ho gaya. So how to deal with those stresses? What are the workplaces offering us to deal with these stresses, these daily stresses, which for some people it might be detrimental, right? Then if I talk on the individual level again, now here I would again mention that it has been seen and it has been reported, and you people also might have heard, that 1 in 4 persons, it has been said, the data says, is suffering from mental health problems. No, I will not say diseases, but problems, right? So when I say the proportion of people who need actually help is 25%, right, in our communities. So which means every other person would need one or the other to talk to discuss these issues and to seek help whenever needed. So as an individual, I need to have a community of close people where I can discuss the things, where I can open up, I can talk about my problems, and I can feel comfortable and find solutions to my problems. तो इसमें सबसे पहले जब हम बात करते हैं, तो एक बच्चा जब पैदा होता है फैमिली में, राइट? सो वी से अ पर्सन डेवलप्स रिजिलियंस. रिजिलियंस इज कि वो कितना एडवर्सिटीज को फेस कर सकता है, लचीलापन कितना हम डेवलप करते हैं, और वो जो है वो डेवलप होता है बचपन में. So I would say that at that level, the development of resilience in a person is dependent upon the family environment. So if I am dealing with adversities in my early life, I am given an environment where I make my own decisions, I am made independent in my family. So obviously later in life also I would be able to solve my own problems, and I might not have problems with my behavior, right? But this personality formation, it occurs in the initial years of our life. So many times we say that a person is in a family, he has a problem family, or he landed into problems, right? So that due to that he has developed this kind of personality. But personality is one thing, right? It is not that ek bar personality ban gaya wo change nahi ho sakta. Yes, there are problems, there are people who are not able to deal with bigger stresses, like say for example someone has lost their parents in the early childhood, so that might be a big problem. But otherwise, in the normal family, if a child is growing, he should be given a parenting which should enable him to take self control. आजकल बड़ी एक बहुत बड़ी प्रॉब्लम, इवन माई सेल्फ एज अ पेरेंट आई हैव सीन दैट वी आर सो मच ओवर प्रोटेक्टिंग आवर चिल्ड्रन. I mean, until they go to school, even when they go to the college, and these days we are like in constant touch. So students, I mean the kids, they're not allowed to be independent. Or this thing is going to affect them in later life, where actually they have to be autonomous, and they are not able to deal with the situations in the life. These days, if you see again, even as adults, we are seeing a rise in the cases of workplace conflicts, marital conflicts, and these all things are happening because maybe, I mean, I might not be right, maybe for some it might be that we have not been able to actually tackle our problems in a way our parents or our forefathers used to, because they were resilient. We people never developed that resilience, and this is going on. We don't have patience, we don't have I would say maturity to deal with those things. So that is very important. As a parent, as a community, as friends and family, we should be offering that environment to the children to grow in their years of growing, so that they develop good mental health. And yes, of course, once they need help, it's not that everybody can deal with all kinds of stresses. So there are situations, like for example, going to a school. It's in itself is a stressful situation for the students, right? So at that time, having contact with the society, with the other people, with friends, making friends. Ajkal, most of the time we are having virtual friends but not social friends, right? So that all keeps on adding to these problems. So these all things have to be taken care by the family, that a child is given an environment where he develops his own personality. Then we also, like, these days, in the past 2 years, there has been a rise in the number of, I would say, depression, stress, because we were all facing the problematic time, COVID. Some of us dealt with it, some of us had the burnout, some of us had problems. And data, there have been studies, if you have gone through that, in the past 2 years there has been a 25% increase in the number of mental health problems. So that is all because we were never exposed to such a situation, and we didn't know what to do, whom to talk to, how do we connect with people. So everybody responded differently, and that is how, I mean, we deal with these situations.
Very true. Thank you so much, ma'am. Thank you so much for having a wonderful conversation with us. Any last message to the audience?
Yeah. So at end, I would just like to say that other than your family support, every person should have some kind of, what we say, a close group where you can talk, you can open up, you have any problems, you can discuss with them. So do identify 2 or 3 people in your family, in your close friends, so that you all at least have a space to open up. Secondly, always engage yourself in some other activity other than your routine. Like, most of us might be working or students, so we are just focused on our work or on our job or on studying. So having a hobby, earlier we used to, आजकल hobby एक ही है, mobile पे चलाना, game खेलना. Other than that, having a physical hobby, maybe games, maybe painting, drawing, literature, reading books, because that gives you a space. Your mind gets a space where it can think something else, right? So you should engage yourself in some other activity so that you don't get bored of your routine lifestyle, which actually we all are into these days, right? So as a student, as in the community, we all need to have some other motive, I would say, a reason to live and a reason to celebrate our lives other than what we are actually doing.
Thank you. Thank you so much, ma'am, for this conversation. I hope this conversation will help many of us to get understand that what is mental health and how we can keep us mentally healthy, right? Thank you, ma'am. Thank you so much for this
It
conversation.
was a nice experience.